Hello, everyone, and yeah, welcome to another session in our rapid response series. So it's the penultimate session just for this, first release, and we're looking at doing more later as well. So yeah, today's topic is one it's a very common question we receive, which is sort of, can we identify a patient in a response if we know who they are? Yeah, it's something we get all the time, and the answer might not always be obvious. So, perhaps you've reviewed the story, spoken with staff, investigated what happened. Maybe you met with the author as well. But yeah, can you acknowledge this publicly in your response or refer to a conversation you have had? So yeah, essentially, can you let them know that you've investigated? So yeah, today we're going to unpack these questions and look at some practical examples and hopefully give you confidence to write responses that feel really personal and authentic with this. Great. So yeah, as I said, today we'll be discussing, can we identify an author? Why might we choose to identify them? Just some, really practical do's and don'ts, and we'll look at the difference that, we can do this in a positive or lower criticality stories compared with higher criticality stories, because I know they're a bit different. And we'll summarize it all at the end with some key takeaways. Um, Brilliant. So first things first, can you identify patients in your responses? And the answer might be quite clear. Yes, we absolutely can. We do say if you know who they are as well. So in fact, if you've investigated the story or spoken with the author or met with them, pretending you have no idea who wrote the story can actually make the response feel quite impersonal. And so this is something we're noticing, and this is, one of the reasons we had this webinar, is because historically we used to say, if you know who the patient is, because it's anonymous, don't identify them in your response. And then this led to, authors being a little bit unhappy because they thought, are you kidding? I've spoken to this very staff member. How do they not know who I am? So it's a lot more genuine, and it's actually a lot more patient-centered if you do know who they are to include that in responses. But let's look at how it can be done. So I also wanted to start with another question. Why would we identify an author in our responses at all? And so, yeah, you can have a bit of a think of this, see what immediately springs to mind, and we can discuss, these first impulses after the presentation. But as I said, the biggest reason I think is for authenticity. One of the things we hear from authors is that they receive a response, and if they ring the service afterwards, only to discover that that person might not have heard of their story as well. So, um, if if we have authentic responses that talk into an experience that we've had with the patient, it definitely adds to the response being better received. So yeah, treat them like a person, show them that they mattered, you remembered them if you did, and it also enables that lovely consistency as well. So just some overall, do's and don'ts when identifying authors online. So we always want a personalized response that's written, as if you're speaking to them. And we can, of course, also, want to acknowledge previous conversations and really demonstrate that the author's been heard. Yeah, we don't want to pretend we know who the author is if we're not sure, or force identification. And of course, we don't really want to rely on overly generic responses and not a human. And I should have added as well, we also don't want to write their name in the response. I have come across a response in the past, which was lovely, but they did write the name of the patient. So we, took that out. But yeah, put their username in, but if you do know their real name, don't pop it in, just in case they don't want their friends or family to know. Um, But yeah, so occasionally services think maybe they've identified an author as well, and then they're wrong. I have had a discussion recently with a service who said to me, look, I think we know who this is. However, we've been wrong twice in the past when we were pretty confident. So we emailed them offline. So yeah, even if you're remotely unsure, you don't have to confidently write it as though you know exactly who they are. So instead, you could say things such as, we believe we may know who you are, or if this is, in the admission, we think it relates to such and such. And always include your contact details just in case you've identified the wrong person. Then they'll have the opportunity to reach out and to clarify as well. So yeah, so let's get into looking at some responses. So this in this response, I think it was for a crit zero, really positive, lovely story. The father had passed away. Small, smaller health service as well. So the responder here clearly knows who this family is. She refers to their father as a lovely, intelligent, articulate gentleman. And then she also remembers the conversations that they shared. So it feels like a really deeply compassionate and genuine response. So yeah, clearly they knew, sorry, who this referred to. And it would have felt if they just had have said, I'm sure your father was a lovely man, or and pretended not to be aware of who their father was, it just wouldn't have been as relational as it is in this response. So yeah, you can absolutely do it in your positive, lovely stories as well. Now we're going to get into the lower criticality stories. So yeah, this is another, it's not a crit zero, but it's not a high crit. And Louise, refers, or sorry, begins by referring to, the author's birth before mentioning a conversation that they had had earlier that morning. So again, she's had a conversation with this author. If she had have responded and pretended not to know who the author was, it would have come across as less genuine. So yeah, this is another way that you can do it. I also have a story from Royal Perth Hospital, and if you have a look in this section that I've highlighted, not only do they identify that they know, or they think they know which patient this is, but then they actually, because of that, they're able to explain what occurred. So they're writing to the person; they're not writing to an anonymous username, and they're also able to sort of shed more light on the situation as well, which I think is pretty interesting and pretty transparent. So of course you can't do this for every story, but I'm just showing you an example that they were able to do that for this story. Great. Um, Now, moving on to the higher criticality story, so things do become a little bit more nuanced. I do refer to this story a lot, so if you've seen it before, yeah, it's a great response, and a quite a challenging story. So I always do point out to this response because I think it did a really good job. Um, but yeah, so it's actually a crit 5 story, and essentially, without having to read the whole thing, but it ties a link between someone's father's death and the care that they received in the hospital. So it was quite serious, but yeah, received a really brilliant response. So um, in the first response, Jen posted, she of course reaches out and expresses, the seriousness of it, invites the author to contact her. And then she publishes a follow-up response as well, because you have unlimited responses. So in this response, Jan said, they've reviewed the presentations and they haven't been able to identify a situation matching the story, which isn't to say that it didn't happen. And I think that's what makes this really really good. It has that open communication, but it's quite transparent as well. And that's why I think it's quite great on two fronts, and quite relevant to identity and anonymity on Care Opinion, because it does lift a little bit of that, behind the scenes curtain. So it says, that actually we don't know who you are. You're going to have to contact us. But then it also does defend the hospital a little bit, and, even subtly suggests that perhaps there's more to this story, or at the very least, they can't identify anything in their system. So, as a member of the public or a member of the community reading that, even if that story isn't, relating to your experience, you're still able to get a glimpse of, what goes on behind the scenes. They've investigated it, and they can't find anything that, relates to that story, with greatest similarity. So, yeah, I think that's a really great response, and something I do invite all of you to do. If you do have systems where you can really investigate stories and have a look and see if there's similar circumstances, you can absolutely write that in your response. I've looked into this. I can't find anything, but reach out to me and we'll have a look together, sort of thing. So yeah, I wanted to have that story finally in a webinar because I do bring it up a lot. But yeah, moving on as well, we've also got, this lovely response from Pat. So, mentions, I know you've already contacted us. I'm aware of that. And yeah, if you are aware, I think that's a really great thing to add as well, because it does create that continuity of, feedback as well. And then in this response, David Plunkett does something similar. So he acknowledges that the author has already been in contact with staff through another channel. And again, it's just another example of bringing that offline conversation back into the public conversation. And yeah, it's just great because it always gives, it gives light to your internal feedback channels as well, so that, the patient can then feel, quite confident if they go to the internal feedback channel that, people will be aware of this. It gets to the same people a lot of the time as well. So yeah, you can absolutely acknowledge that. And finally, I do want to show these two responses as well. So two different clinicians, which is great to see. You don't just need one clinician, giving a response. I've got, health services at the moment on Care Opinion where sometimes two or three different clinicians respond. Same thing happens in Care Opinion UK and Scotland. They do get a lot of multiple staff responding. So I wanted to highlight this because it's, two different clinicians responding, and both of them have, recognized that they are aware that this patient has contacted the service offline, spoken with them directly. So again, it shows a very human and personal connection. It's not templated, and it's all about creating, this conversation of care, which, it does very well. Brilliant. So, what I want to leave you with today is this. So, if you genuinely know who the author is, really don't be afraid to acknowledge that in your response. So, some of the most meaningful responses on Care Opinion do exactly that, as I've shown you today. And yeah, I do remember as well, speaking with one service who said that sometimes when patients reach out to us, we don't always know whether they've told a story on Care Opinion, and that's why, they've reached out to us. So they don't always know if authors are reaching out because they've told a story on Care Opinion, and I understand that's definitely true. And sometimes, though, when you're reading stories and speaking to patients who reach out, you can pick up on similarities, or you'll recognize the story, when they say it to you. And for this reason, I think it's always good to say, I believe we've had a similar story on care, a similar story come through to us internally, or, this does sound like something I've received internally. If that's the case, can you, reach out? So, if it is something that you think is familiar but you're not sure, you don't just have to ignore that possibility as well. You're more than welcome to, just be honest. I think, I believe as well. So Um, you know, as well, I think there's something really powerful about letting that person know. So feel free to, personalize your responses, acknowledge previous conversations. It tells them that their story wasn't forgotten and someone's read it and someone has remembered as well. And yeah, as I said, of course, always include your contact details. Just in case you're wrong, you want to give them an option to contact you directly in case they want to provide anything new as well. And finally, I want to come back to a theme that we've discussed quite a lot throughout this webinar series. So it's, what do we want the public to learn from this response? Because again, there's always those two audiences on Care Opinion. There's the author, but there's also everyone else reading. So one of the most important things we can demonstrate is that people won't be forgotten, once they've shared their story, or if it comes to you internally, and that their voice has really been heard and someone's taken the time to investigate. So ultimately, that's what identifying an author can achieve. So it reminds, both the author and the public that this isn't a generic response, written to a username, but it's that conversation between people. And so, yeah, Care Opinion as a whole isn't about responding to stories. We need to remember that we're always responding to people. And we want to remember our people where possible. So it is that conversation, it is, you're more than welcome to identify them if you know, but yeah, even if you think you can write that in your responses. And yeah, I hope you've enjoyed the examples that we've used here today of people who have done that quite effectively.